Did you know that 1 in 3 people will get cancer at some point in their life? The sad truth is, many cancer cases are found too late because people don't notice the early warning signs. According to experts, finding cancer early, in stage 1, gives you a much better chance of survival, over 90% for many cancers. But if it's found in stage 4, that chance can drop to less than 20%. I'll reveal 8 subtle warning signs that could genuinely save your life. Don't skip it because 7th one will shock you. These aren't the usual symptoms everyone talks about, they're the quiet signals your body gives off long before things turn serious. Most people ignore them completely, but recognizing these signs could be the difference between early detection and a late diagnosis. You might be thinking, what if I worry about every small ache or pain? Don't worry, this is different. I'll only talk about warning signs that have been proven by science, not myths or social media rumors. These signs have helped many people catch cancer early, when treatment works best. This isn't about spreading fear, it's about equipping you with knowledge that could truly save lives. Now let's dive in. Number 1. Bone pain. One of the most overlooked warning signs of potential cancer is persistent bone pain. Unlike the temporary soreness you might feel after exercise or minor injuries, cancer-related bone pain tends to intensify over time and often worsens at night. When cancer begins in or spreads to the bones, it disrupts the normal structure of bone tissue, leading to a deep penetrating ache that's hard to ignore. Primary bone cancer, known as osteosarcoma, typically affects the long bones in the arms and legs. Bone pain that doesn't respond to typical painkillers or feels like it's in the bone itself rather than the surrounding muscles or joints should never be ignored. They're signals your body is sending you that something isn't right. Number 2. Body rash. Certain types of skin changes can signal something far more serious than a simple irritation. Leukemia. A cancer affecting blood-forming tissues can reveal itself through distinctive skin symptoms often mistaken for minor conditions. One key sign to watch for is a type of rash called petechiae. These are tiny red or purple spots that appear on your skin and don't fade or lighten when you press on them. Unlike a typical rash, petechiae are caused by low platelet levels in your blood, which can lead to tiny blood vessels leaking under your skin. Unlike common rashes that might itch or disappear after a few days, if you notice these signs, it's crucial to consult a doctor immediately. Early detection can make all the difference in addressing leukemia effectively. Number 3. Unexplained night sweats. Night sweats that soak your bedding and clothes could be more than just a warm room, when these episodes happen frequently and aren't tied to environmental factors or menopause. They might be a sign of lymphoma, a type of cancer that affects the lymphatic system. These night sweats often don't come alone. They're frequently accompanied by fever, unexplained weight loss, and overwhelming fatigue. These intense sweats result from your body working overtime to combat cancer cells. The immune system's response to lymphoma releases inflammatory chemicals that disrupt temperature. The key difference between harmless night sweats and those that warrant concern is their frequency and severity. If you find yourself waking up drenched night after night, especially if other symptoms like fever or weight loss are present, it's time to pay attention. What should you do? Don't brush it off as stress or a warm bedroom. Persistent and severe night sweats should always prompt a visit to your doctor. Even if cancer isn't the cause, other conditions like infections or hormonal imbalances could be at play, and catching them early is always beneficial. Number 4. Fingernail marks. Changes in your nails might seem minor, but they can sometimes reveal something far more serious. Like subungual melanoma, a rare form of skin cancer that develops under the nail. One of the most common warning signs is a dark vertical streak running underneath the nail. Key warning signs include streaks wider than 3 mm, streaks with uneven or varying colors or blurred edges. If you notice changes to your nails, especially dark streaks accompanied by pain, nail splitting or bleeding, seek medical advice immediately. Number 5. Jaundice. Have you ever noticed a yellowish tint to someone's skin or the whites of their eyes? This condition, called jaundice, isn't just a cosmetic issue, it's often a sign that something serious is happening inside the body. Jaundice marked by yellowing of the skin and eyes occurs when bilirubin builds up in the body. While it can stem from various causes, a sudden onset in adults is often a red flag for pancreatic or liver cancer. Other symptoms to watch for include dark urine, light-colored stools, and upper abdominal pain. These are signs that the body isn't processing waste properly, and they need immediate attention. It's important to remember that jaundice doesn't always indicate cancer. It could be caused by gallstones, hepatitis, or another condition. But if it appears suddenly and without an obvious explanation, it's critical to see a doctor right away. Number 6. Persistent headache. A headache that won't go away. Despite taking over-the-counter or prescribed medications can be alarming. If you find yourself with a persistent headache lasting more than 2 weeks, it's time to see a doctor. This type of headache could be a warning sign of something more serious, such as a brain tumor or other brain cancers. In addition to the headache itself, other neurological symptoms can accompany it. These might include blurred or double vision, changes in hearing, or facial drooping. Brain tumors can put pressure on nerves and disrupt normal brain function. This type of headache is associated with dangerous symptoms. These are headaches related to cancers that do not respond to conventional treatments, and should be thoroughly investigated for a long time. Number 7. Eye pain. Your eyes can reveal critical clues about your overall health, including potential warning signs of cancer. Ocular melanoma, though rare, is the most common type of primary eye cancer in adults. What should you look out for? One red flag is blurred vision that doesn't get better, even with new glasses. Another is unexplained flashes of light, similar to what people experience with migraines or retinal issues. And perhaps the most noticeable but often ignored sign is a dark spot on the iris. If this spot grows, changes shape, or changes color, it's time to act. Certain factors can increase your risk, like having fair skin, light-colored eyes, or spending a lot of time in the sun without proper eye protection. Eye exams are especially vital if you have risk factors such as prolonged sun exposure or a family history of eye cancer. Catching these warning signs early is key to protect your health. If you found this information valuable, please give it a thumbs up, share it with someone who might need it, and subscribe to our channel for more life-saving content. Your support helps us spread awareness and empower more people to take charge of their health. Stay safe and thanks for watching.